Pregnancy is one of my favorite topics. I'm Janet Colson and teach nutrition at Middle Tennessee State University. Pregnancy is the period of most rapid growth and development in the entire lifespan. Successful pregnancies depend on what we eat before and during these 9 months. Pregnancy requires a healthy egg from the mother and sperm from the father. Women must be at a healthy weight to release an egg each month during ovulation. If an egg is fertilized by a sperm, a zygote forms, travels through the fallopian tube, and is implanted in the mother's uterus. Nutrients from the mother's diet are stored in her uterus to nourish that zygote. Therefore, the diet of the mother before pregnancy are very important so that there will be an adequate supply of nutrients stored in her uterus. The father is pretty important too. Healthy sperm requires that he be at a healthy weight, not too thin and not too heavy. Avoid excessive alcohol, tobacco, and cannabis, and then also eat a healthy diet. The healthy diet for pre-pregnancy is very similar to that needed in pregnancy and at all times in the life. Adequate amounts of omega-3 fats from fish like salmon, vitamin D from dairy foods or from supplements, folate from food, leafy greens are the best, or from supplements if a person doesn't like green vegetables, and then iron-rich foods. Beef and chicken liver are two of my favorites. Last year, we had 5 Egyptian exchange students at MTSU, and they introduced us to an Egyptian sandwich made from liver. It was delicious, but it's also a great source of iron. There are certain things that decrease fertility, and fertility is the ability to become pregnant. Underweight women and men are at higher risk for infertility. Emotional stress, exercising too much, and also consuming too much caffeine. Exercise is beneficial for health, but too much can decrease body fat, which decreases estrogen. As estrogen levels decrease, ovulation stops, and an egg is not released each month, and women stop menstruating. Excessive exercise and fertility can be a problem. This slide is from a textbook that I use in the U.S., and this estimates the incidence of irregular or absent menstrual cycles in female athletes compared to sedentary women. You can see at the bottom of the slide, sedentary women only have a 13% chance of irregular or absent menstrual cycles. And again, a woman needs to menstruate to be able to release an egg. Women who are too thin with too little body fat do not menstruate. Actually, their estrogen levels go down, and estrogen is the hormone that is typically released early in the menstrual cycle. It peaks out when a woman ovulates, and then it decreases again. But in looking at competitive bodybuilders, they have an 86% chance of irregular or absent menstrual cycles. Bodybuilders like to have very, very low body fats so that their muscles pop. And because of that, they have lower body fat, lower estrogen levels, and don't menstruate. Caffeine infertility is also a problem. Studies show that caffeine decreases the chances of pregnancy in many women. A 500 milligram intake of caffeine decreases the chances of becoming pregnant by about 50%. 300 milligrams decreases it by about 27%. The caffeine spectrum illustrates that tea contains caffeine, but nowhere near as much as coffee products. Hot coffee, 140 milligrams, cold brew coffee, slightly more at 155, and then nitro, a whopping 215 milligrams. Nitro is a new product that is popular in the U.S. It consists of cold brew infused with nitrogen gas. In the US, we're also seeing more caffeinated products. On the left, the red, the Vita Energy, those are caffeinated mints that have 40 milligrams of caffeine per tiny mint. This entire bag has 250 mints. On the right, Zenergy chewing gum that provides 50 milligrams of caffeine. The growth and development rates during pregnancy are rapid. In fact, growth rate is highest during pregnancy, and that's of the fetus. Think about it. The egg weighs almost nothing. And over 9 months, that egg divides and eventually results in a baby that weighs about 8 pounds. If the rate gain continued at this level, by 1 year of age, infants would weigh a whopping 160 pounds. But most infants weigh about 20, 21 pounds at birth, or at 1 year, not at birth. They typically weigh about 7 or 8 pounds at birth, and then they triple their weight by the time they turn 1 year of age. This chart shows the fetal weight gain during gestation. I believe that this is important so we can see when the various nutrients are deposited into the fetus. You might want to stop your video at this time just so you can get a better look. But again, in looking at the top, the body weight of the fetus is only 10 grams, just very tiny at 10 weeks. It increases to 300 grams by 20 weeks, but then by birth, it is 10 times that size, 3,450 grams. At 30 weeks, and many preterm babies are born around 30, 32 weeks gestation, weighing only 1,667 pounds. And looking at the protein, it accumulates mainly at the latter part of pregnancy. The fat accumulates a lot. At 30 weeks, babies are typically just skin and bones with no fat deposited under the skin. And typically only 66 grams of fat. But by the time they're born, they have more fat deposited with about 525 grams of fat. Then at the bottom, we have the mineral deposition, and you can see that most minerals are deposited at the latter part of pregnancy. The components of mother's weight gain. The placenta is an organ that develops inside the uterus during pregnancy. At 10 weeks, that placenta is small, only about 20 grams, but by the time the baby is born, it weighs 670 pounds, and that contributes to part of the mother's weight gain. The uterus expands, the amniotic fluid expands, the breasts expand, going from only about 45 grams at 10 weeks, that's an increase of 45 grams, to 448 grams at birth. A lot of times I tell my American students that to expect to go up about 2 bra sizes during pregnancy. The blood supply expands so that nutrients can be delivered to the fetus. And then there's also a normal and a healthy increase in fat. A lot of girls say, "Oh, I don't want to gain any extra fat during pregnancy," but that's beneficial because ideally, after you have a baby, you want to breastfeed. So to produce breast milk requires a fat store. The weight gain of the mom versus the fetus. This graph is divided into trimesters. The first trimester is basically the first 3 months, but you can see that the mother gains very little weight during that time, and the fetus is almost nothing. Beginning at the second and third trimester, the mother's weight gain remains pretty constant, typically about 1 pound per week during that phase. But the fetus does not begin really putting on weight until about 24, 28 weeks. Weight gain by trimester, I like looking at this because sometimes girls are worried about their body size. At the end of the first trimester, you can see there's a very small protrusion of the abdomen, not that much at all. Usually A girl's waist begins to get bigger, but it's not protruding out to the front. If you have a 24-inch waist before pregnancy, your waist might be 28 inches at the end of 3 months. Then you can see during the second and third trimesters, typically there's maybe a 6 kilogram increase in weight. Now, weight gain during pregnancy is something that some girls don't like to think about. Some women think that they're eating for two and eat twice as much as before. This results in excessive weight gain, with increases in the risk of complications for the mom and the baby. Proper weight gain and total weight gain optimizes birth outcomes. Pregnancy weight gain recommendations is based on the pre-pregnancy weight. If a woman goes into pregnancy underweight, she needs to gain slightly more, 28 to 40 pounds during the 9 months of pregnancy. If you're healthy weight prior to pregnancy, 25 to 35 pounds, overweight 15 to 25 pounds, and then obese women 11 to 20 pounds. Now, this are the weight gain recommendations if you're carrying one fetus. But if you're carrying twins, obviously you need to gain extra weight. A twin, the extra baby will account for part of the weight, but the woman's uterus will expand even more. And then in most instances with twins, the woman will have two different placentas. Now, if you're carrying triplets or quadruplets, the weight gain is going to be even higher. In the US, the medical charts of most pregnant women include a graph similar to this, so that each month when a woman goes in for her checkup, they will weigh her and then they will plot her weight gain on a chart similar to this. You can see at the bottom, the overweight woman needs to gain at a lower rate. The normal weight woman, as I said before, typically they're going to gain about 1 pound a week. And then I'm sorry, I had this backwards, but the blue is the overweight. The middle one is the healthy weight woman, and the upper is the underweight woman. So again, the underweight woman gains more weight than the healthy weight or the overweight woman. Weight gain is related to calories. So how many calories do we need by trimester? In the first trimester, we really don't need to increase caloric intake. We're not gaining weight. During the second trimester, caloric increases to 340 extra calories per day. So if a woman normally was eating 2,000 calories, she needs to increase to 2,340 calories. During the third trimester, she needs an extra 450 calories per day. Again, the fetus is growing more at the latter part of pregnancy, so those additional calories are needed for the fetus. So what nutrients do we need during pregnancy? During the pre-pregnancy period, we need about 46 grams of protein per day. Most people consume more than that, but the 46 grams are based on 0.8 grams per kilogram of body weight. During pregnancy, about 71 grams of protein are needed. That's an additional 25 grams. Carbohydrate needs increase. Most people don't have to worry about that. Folate needs doubled during pregnancy, going from 400 micrograms to 600 micrograms per day. Now, ideally, women in the pre-pregnancy period, any woman of childbearing age needs to be very concerned about her folate status, because folate is needed during the early part of pregnancy, typically before a woman even knows she's pregnant. Calcium needs, surprisingly, don't change. During non-pregnancy, pre-pregnancy, 1,000 milligrams, and they remain 1,000. You might be wondering why, but if you remember the table before, the calcium needs of the baby, of the fetus, are not very high. And the calcium is not deposited in the fetal bones until the latter part of pregnancy. So ideally during pregnancy, if you've been eating an adequate amount of calcium, then you go into pregnancy with good calcium stores. During pregnancy, the amount of calcium is increased. Those are stored in the mother's bones so that at the latter part of pregnancy, there'll be a store of calcium for the fetus to draw on. Now, iron needs really increase during pregnancy. 18 milligrams for the pre-pregnancy, and in the US, our recommendations are 27 to 30 milligrams per day. But the World Health Organization recommends 30 to 60 milligrams a day. That is a lot of iron. Typically, in an average 1,000 calories, we get about 7 milligrams of iron. So if a woman eats 2,000 calories per day, that's only 14 milligrams of iron in the average diet. If you increase your calories a little bit during pregnancy, it's almost impossible to eat 27 to 30 milligrams of iron. The iron needs increase because of the fetus. The fetus and the placenta, at birth, there's going to be about 300 milligrams of iron in them. Blood loss at delivery has iron in it, about 250 milligrams. And then during pregnancy, we need about 450 additional milligrams of iron for the increases in the red blood cell mass. The RDA for iron, incidentally, is based on this. They go out and figure out these types of numbers, and then they divide the total number by 280 because there's 280 days in a pregnancy. And from that, they're able to come up with the iron needs. And another note, 4 ounces of beef liver has 5.5 milligrams of iron. And I don't mean to emphasize that so much. I was curious about iron deficiency in Pakistan. And I found this article, and it was published in May of 21. But they looked at 500 women in the 3rd trimester of pregnancy. And it was collected in September of 2020 through January of 2021. So that was during the pandemic. And that may have had a little bit of impact on the outcome. But what they found, they were trying to determine what percent of women had iron deficiency. And these are pregnant women. And they found that 63% were iron deficient. 25% had severe iron deficiency, but only 12% have adequate iron stores. And they concluded from this that the iron deficiency was related to a poor diet. When we look at our global diet, we have, as a world, we eat poorly. We eat a lot of junk and processed foods, and typically those are low in iron. Iron supplements are typically recommended during pregnancy. Now, if you're trying to get 30 milligrams of iron, 30 to 60 milligrams of iron, a supplement is really necessary. A problem with iron deficiency in pregnancy is that there's an early pregnancy risk of preterm delivery and low birth weight. And also, the baby who is born might have lower scores of intelligence. Their IQs will be lower, their language, their gross motor, and also their attention spans tend to be lower. So to have a healthy baby, iron status during pregnancy is very, very important. And I do believe that the purpose in a pregnancy is to have a healthy baby. I love hormones. And this is a hormone that is released from the chorion during early pregnancy. Now, the chorion is the membrane that surrounds the zygote. And this hormone is released from that membrane early in pregnancy. Many years ago, we thought that this was why so many women developed nausea, morning sickness during pregnancy. But we'll talk in a second about another hormone that's been identified. But the HCG, you can see from this illustration, is high in early pregnancy. This is week 10, so it's very high. At week 10, it starts being released probably at about 2 weeks gestation, and then it goes back down. These other two hormones, progesterone levels, increase throughout pregnancy, and then estradiol or estrogen increases throughout pregnancy. During the normal menstrual cycle, the estrogen and progesterone levels increase. That causes ovulation to occur. Then the levels go down as the woman begins to menstruate. But during pregnancy, women stop menstruating, and these hormones continue to increase. How do pregnancy tests work? It's this hormone that is detected. The HCG binds to the antibodies in the test, and it turns the test pink. So if you're pregnant, this test turns pink. Nausea in pregnancy is something that many women don't like to think about, but it is a reality. Morning sickness is mild nausea that might result in vomiting. About 70% of women have some mild nausea. It typically goes away by 20 weeks. The vomiting that does occur does not result in dehydration or hospitalization. Hyperemesis gravidarum, however, is severe nausea with constant vomiting. Thankfully, it only occurs in 1 to 2% of women. This type vomiting and nausea lasts the entire pregnancy, and it can result in dehydration and hospitalization. You might remember Princess Kate had this condition, and with her first pregnancy, it made the news. But she actually had this condition with all three pregnancies. It is something that is genetic. So typically, if a woman has this condition with pregnancy one, she will have it with the other pregnancies. Many women who have this, they're so sick during the first pregnancy that they decide not to have any more babies. And we're so glad that Princess Kate had additional babies. This condition is linked to a hormone, and it's abbreviated GDF15, that stands for the growth differentiation factor 15. But this study found that this hormone is implicated in the nausea and vomiting, especially in severe hyperemesis gravidarum, but they don't really understand what causes it. In this report, they find that fetal production of this hormone and maternal sensitivity to it both contribute to the risk of hyperemesis gravidarum. Again, this study was published in 2020. I was trying to find when this hormone was first identified, and it was maybe 10, 15 years ago, so it is relatively new. How does the hormone affect pregnant women? Now, it does some good things and it has some negative effects. It helps maintain early pregnancy. It promotes placental formation. It acts as a protective mechanism for the mother and the fetus in times of stress. And then it serves to protect the mother from toxins. But the adverse effects is that it can cause nausea and vomiting. Pregnancy-induced hypertension is another condition that we see pretty often in pregnancy. It is characterized by high blood pressure that starts during pregnancy. In the U.S., it affects about 10% of pregnancies. Preeclampsia is an elevated blood pressure with protein in the urine. This condition typically occurs later in pregnancy. Now, eclampsia is a more severe form of preeclampsia that may result in death. I was curious about the prevalence of pregnancy-induced hypertension in Pakistan, and I found this article. But what they did is they actually compared India, Pakistan, and two African countries. But the results from India and in Pakistan, they looked at 10,000 women. And what they found is that the estimates of pregnancy-induced hypertension was 11.6%. So it is a pretty big problem in Pakistan. In looking at the number of women who had preeclampsia with this, it was 4.3%. And then you can see the severe form of it, the eclampsia was 0.1%. It is seen, but it's very rare. But again, it's good that it's rare. Typically, when a woman is diagnosed with preeclampsia, she might even be hospitalized, but they do everything to make sure that it does not progress into eclampsia because of the life-threatening situation that it can put her in and the baby. Now, diet for pregnancy-induced hypertension. Surprisingly, it's not the sodium. But the best thing for a woman to do is to eat a healthy diet that has ample fruits and vegetables because of the potassium. And we all know that potassium helps to lower blood pressure. And then also ample calcium from dairy and green vegetables. For the woman to get regular physical activity, and that's not weightlifting, but just normal walking, maybe yoga, bicycle riding, and then to maintain a healthy weight. Healthy weight is so important before pregnancy and during pregnancy. Gestational diabetes is another condition, and this is also related to women going into pregnancy who are not at a good weight and who are eating poorly. But gestational diabetes is elevated blood glucose levels during pregnancy. Women are screened for gestational diabetes at about 24 to 28 weeks. And the screening consists of a woman going in a fasting state. They draw her blood, and then they give her this sugary drink. And then they draw her blood an hour and 2 hours afterwards to see how she tolerates that glucose. It's actually called a glucose tolerance test. Now, the problem with gestational diabetes is that the high blood glucose levels in the mother are transferred to the baby. And it's just like overfeeding the baby, giving them too much sugar, and it causes the baby to get too big. So a woman who has gestational diabetes might have a 9, 10, 11, 12-pound baby, and it's more difficult to deliver a large baby. The risk factors for gestational diabetes. If a woman goes into pregnancy overweight or obese, if there's a lack of exercise before and during pregnancy, if she has pre-diabetes before she's pregnant, previous pregnancy with gestational diabetes, if she has a polycystic ovarian syndrome, if she has an immediate family who has had gestational diabetes, like if your mother or sister or even an aunt had it. And then if she had a previous baby that was large, 9 pounds or larger. I was curious about the prevalence worldwide of gestational diabetes. And according to this chart, Southeast Asia, 29 or 25.9% of women in Southeast Asia have gestational diabetes. When you compare it to the rate in Africa, only 13%. And I was wondering, why is that true? When you think about African women, they don't typically drive cars. They don't typically have a lot of processed food. So they typically are at a healthier weight, and also they eat less processed foods. Cravings. Cravings are a strong desire for a certain foods, such as pickles and ice cream, or at least here in the United States, we always say, oh, pickles and ice cream are what pregnant women crave. But this is not associated with nutrient deficiencies. However, pica is associated with iron deficiency, and pica is craving and eating non-food substances, such as dirt, clay, and crayons. This might be a sign of iron deficiency, but of course, eating the dirt and clay can also damage the lining of the gastrointestinal tract. One of my first jobs was working with the WIC program, and here in the U.S., the WIC program is a supplemental food program for pregnant women, infants, and children. One thing we were required to ask the pregnant women, do you practice pica? And they would sit there and look at you like you were crazy. And then we would say, do you eat non-food substances? And they would typically say, oh, yes, I drink Coke and eat chips and candy. And we're like, no, do you eat dirt, clay, or crayons? And they would look at you totally like you were crazy. But there were several women that I worked with who did describe their desire for eating dirt. I was curious about Pakistan. Is pica common in Pakistan? And I found this article. What stops us from eating? A qualitative investigation of dietary barriers during pregnancy. And what they did is and this was a qualitative study, but they looked at 41 women. They did an in-depth interview of about half of them. And then they did focus groups with the others. And looking at the characteristics of these women, they were pretty well educated. That most of them were 25 years or older, and they all had had previous children. The results. Food cravings. Interviews revealed that women craved a variety of sour, sweet, and salty foods, with preferences varying across pregnancy. Other cravings included non-edible or non-nutritive items such as ice, chalk, or dirt, a condition otherwise known as pica. And this is actually verbatim from what the study showed. One healthcare worker said some pregnant women develop a craving to start eating clay and coal. And those were the women she had worked with. And a mother said, when I was pregnant, I craved eating baked clay, particularly in the last trimester of the pregnancy. My mother-in-law had forbidden me to do so, but I was eating it secretly. So again, to me, it was interesting that pica is pregnant here in the U.S., and I've worked with women who practice it, but it's also common in Pakistan. So what should we eat during pregnancy? Avoiding undercooked protein foods, undercooked eggs, meat, and raw fish or sushi. These might be contaminated with bacteria that could cause illness in the mother that would subsequently damage the fetus. Excessive amounts of caffeine, as mentioned before, alcohol, no alcohol at all, and certain types of cooked fish. The fish that contains mercury. Typically, a larger, older fish will have more mercury in it than a younger fish. What should we eat? Oatmeal. Approved fatty fishes such as salmon, leafy green vegetables, the more the better. Nuts are high in healthy fats, beans and lentils, excellent source of protein, fiber, and also many vitamins and minerals. Yogurt, avocados, again, has lots of healthy fat in it, and then lean meats are the way to go. So pregnancy, what you eat in pregnancy and before pregnancy really has an impact on the baby. And as I mentioned before, the importance of pregnancy, the reason we become pregnant is to have a baby. And we want that baby to be as healthy as possible. And what we eat before and during pregnancy is very, very important. If you have any questions, please contact me at janet.colson@mtsu.edu. These are my sources.